There was a lot of things going on in my life personally that probably affected it.
Everything in our family had kind of been like emotional, like because as my mom told you, like a really close friend of ours passed away.
Wasn't feeling good, couldn't sleep the night before, and was really jittery. Thought he was maybe just anxious, went for a jog, things like that. It didn't make him feel any better. So he got up and went to school the next day.
Then she was like, we're going to the hospital, like Dad's in the hospital. I was like, wait, like what? Like I started like really freaking out.
Richard's heart attack was severe enough that his heart was not beating in an organized rhythm. So in VFib, the heart just quivers, so it doesn't move any blood. So we shocked them, and we got his heart back to an organized rhythm at that time.
It was within minutes, had me up in the cardiac cath lab and saved my life.
How are you? Good to see you. Welcome to Anderson.
This is a young guy who appeared fit. I think he was a runner, just a guy who really practiced a healthy lifestyle.
And so we were a little shocked and overwhelmed, as you can imagine, but they were very comforting, reassuring, and
they accommodated us in every way. My wife was real happy from the care they gave me.
This hospital hadn't been any more than 5 minutes away, like he wouldn't be here.
So to travel 20 to 30 minutes to another hospital, there probably could have been a lot more cardiac damage done.
To be honest, I didn't even know we had a cardiac cath lab here until we had to use it. But if that hadn't happened, he wouldn't be here.
Anderson Hospital is unique in that we can give patients emergency care when they have their acute heart attacks rather than having to send them over to St. Louis.
Cardiac events oftentimes happen in the middle of the night. Such was the case for me several years ago. It is so reassuring to me and to my family to know that expert care is available to me throughout the night.
The reason having a 24-hour cath lab is so important is that it decreases the delay in getting the artery open that's causing a patient's heart attack. The quicker we can get that artery open, the less heart damage they will sustain.
One of the unique things about having a single cath lab is that and then trying to have a program where we address emergent situations, that when that occurs, we have to take that patient off the table.
If we're only working out of one cath lab and an emergency comes in, a defibrillator implantation or a pacemaker is not something that you can stop what you're doing to take care of the emergency patient.
I'm a big believer in community services, so the idea of having a cardiac cath lab for situations even like mine is very important. This community is growing.
We were pleased to have been given the opportunity a few years ago to contribute to the expansion and renovation of the intensive care unit at Anderson Hospital. So it's only a natural with this expansion of the cardiac care facility that we would enthusiastically support that effort.
We really appreciate the support that we have received in terms of this project. The financial support is very important. Medical equipment is expensive, remodeling is expensive, and the construction involved, and so we really do appreciate the support that our community has provided on this project.